Hey everyone, welcome back. Sorry it has been a while. I have been laid up. I had a test done and they showed some precancerous stuff, and so I had to go in and have a small surgery. And for 2 weeks I was laid up. So now I'm back, and it actually brings up the topic of what we need to do as addicts when we have to take medications for like a surgery or something like that. So that's what we're going to talk about today on the Mindful Addict. What the hell to do when you have to take medication from a surgery. My name is Darren Ford, and I'm your host. You might notice a bit of a different setup here at my desk, which is also in my bedroom. So enjoy. So I'll share a little bit about what happened for me. I went into the doctor's office and they did some tests, and they said, hey, it looks like you have some abnormal precancerous cells. Good thing that we caught them. It's no big deal, but we're going to have to go inside and remove them. And then the doctor turned around and wrote me my prescriptions for after surgery. And one of the prescriptions, knowing that I'm an addict, one of the prescriptions he wrote was for 60 Norcos. Now, there is no reason, unless I'm having like open heart surgery, that I would even possibly need that many of those medication, right? Of that type of medication. I mean, that's a potent medication. So, of course, I did not get them filled. I brought the prescription straight home, showed my partner, who held on to it. I immediately told on myself to my sponsor. And then I sat back and waited a few days, went to a few meetings, and then I started to Zoom with my sponsor to come up with a plan of action, or what I call a POA. In one of my books, the Recovery Coaching Client Handbook, we created a whole activity there to help you create a POA, or a plan of action. And so that's what I did. And that plan of action included, me not having any control over the medications. So, they were all, that control was given away to my partner. He would dose the medications to me. That plan of action, that was number one. Number two was that I had to relinquish control of all of my companies. I have 4 different companies, and so, I had to tell my respective chiefs of operations there that, and all of the staff for each company, that I had to step back, and that I would not be participating with anything related to my companies, because if my mind is compromised, then I have no business running my company. So that was number 2, right? Number 3, make sure that I was checking in with my recovery community pretty much as I could. Number 4 was that I couldn't go back to work, because I do have a problem with working too much. I could not go back to work until my partner cleared me, or my sponsor cleared me to go back to work with my operations departments for each one of my companies, right? And then the 5th thing was I, had to take care of myself. And that's exactly what I did. And now I'm back, and I'm cleared to come back to work, and I'll be starting work on the 1st, and here I am with you all. So now those are the things that I needed to do, right? The things you may need to do might be different. And for you, I mean, to be quite honest too, Norcos or those types of medications aren't really my thing. Even though opiates or pain medication are not the type of drugs that I particularly gravitate towards, I more gravitate towards like Xanax. And once my mind is compromised, I can't trust myself, because with a compromised mind, I have a greater likelihood. All addicts have a greater likelihood with a compromised mind to regress to the most innate and ingrained habitual behavioral patterns that they had, right? That is the same thing for you. And so when you create your plan of action, even if it's not a drug that you particularly favor that you have to take for your surgery, it doesn't matter. You still have to treat it with the seriousness that it deserves. And you still have to make sure that you are positioning yourself to be insulated to the best of your ability to anything related to the the unconscious addictive pattern arising. So, with that, you can, go over a plan of action with sponsor if you don't have a sponsor, with your therapist if you don't have a therapist, with somebody in a recovery community. And if you don't have a recovery community, you got bigger problems, because you have to have a recovery community, right? There is no recovery without also having a recovery community to depend on. So just like I said in my previous episode of The Mindful Addict, you have to have a connection to a recovery community, just like you had a connection to a community of support when you're in your addiction, your dealer, right? People to hang out with, all of those things were the community of people that you depended on to help facilitate your addictive patterns. And so you have to do the same thing when you're in recovery. And so you depend on your recovery community. And if you're going into surgery and you don't have a recovery community, then you need to get to a 12-step meeting or call a therapist immediately and get into some sort of supportive process, or even a coach and the number 4 and then recovery.com. And they do coaching, just recovery coaching. So it's not like as expensive as therapy, but it still can offer you supportive services. So that's the idea here, right? Take it seriously. When you're going into treatment and you're going to have to take medication, you need to take it seriously. Number 2, you need to make sure you have a POA, a plan of action, a way to insulate yourself from those unconscious, impulsive, habituated behaviors, because what medications do is they shut this part, that prefrontal cortex, our ability to reason and judge. They suppress the neural activity in that area, amongst other areas in your brain, but also that area. And so your ability to inhibit yourself from your addictive behaviors becomes more difficult. These are the things that you need to do when you have to have a medical treatment and you have to take meds. And the other thing is remember, there are other things that you can do other than pills, right? You can spend time meditating, allowing yourself to be present with the discomfort. I'm not saying that you have to sit there and let yourself cry if the pain's overwhelming. Obviously, the pain's overwhelming, you have to take medication. But, you still have the ability to, take a deep breath, notice, relax yourself into the pain, right? Allow yourself to be curious about it, right? To wonder what would happen if you do this, if you allow yourself to be present with that pain. What will happen to the pain? You'd be amazed at how it changes. One way to practice doing this is to, when you're in meditation and you notice that you feel like you have something that itches or a discomfort, maybe a pain in your knee, as long as you don't have knee problems, or something. Obviously, you don't want to cause damage to yourself. But you can sit and be present with that sense of itchiness or the sense of aching in your back or your knee. And notice it and come back to your breath, and notice it and come back to your breath, right? And be curious about it. And doing that process does the same thing as teaching you how to, it's a precursor, right? It's a practice that allows you to rehearse for the finals, which is when you are in serious pain. So, this is another option, and that can be part of your plan of action or your POA. So the point here is that there are endless plethora of possibilities. There's also just Tylenol, right? Which I'm not saying to take, I'm not a medical person, so I'm not endorsing any pharmaceutical or anything like that. But my point being, I shouldn't probably even use the word Tylenol. What I should say is there's over-the-counter medications, right, that you can take, and over-the-counter medications that your doctor can recommend. And that's the last thing I would say, right, is that you do exactly as your doctor recommended with the meds, right? So just because my doctor prescribed 60 Norcos doesn't mean, hey, I can just start popping them, right? No, it means I want to take as few as possible, but I never exceed the amount that my doctor recommended at all, right? So if the on the pill bottle it says 1 a day, then that's all I take. And how do I know that I'm going to have the mind to be able to adhere to those boundaries? I'm going to have somebody whose mind is not being altered by the medication giving it to me. All right. So when we have medical issues, of course, we have to embrace that reality. We have to do what our doctors say, but we also need to have a plan of action to help us align with the reality that we are addicts. And when we are on medications, this part of our brain, right, gets shut down, and we left to its own devices, the mind will do what it knows. And that means the mind will go back to the ways that it knows to treat itself whenever there's discomfort. Okay, well, thank you so much for your time. Please be gentle with yourself, and I'll see you back in a little while. Take care. Bye-bye. Let me know if you have any thoughts or comments, any topics that you want to hear about, or anything. We are going to have people on for interviews. This is also part of the reason why we set this new setup up, was so that we could do interviews, because the other way we couldn't do interviews. So I'm excited for that, and I'll let you know. Maybe I think I said this before. We'll have Aaron on. He's the guy for Coach for Recovery, and I also have a venerable monk who has struggled with addiction and compulsion, who has said that he would be willing to come on. So we will, a Buddhist monk. So we will talk about that and what that's like for him. So thank you all so much. Have a beautiful day. Be gentle with yourselves, and I'll see you again. Bye-bye.